Welcome back to the Dan Proft Show. And TJ Rogers is a founding CEO of a significant semiconductor corporation, that is. He wrote in the Wall Street Journal this week about enlisting his engineers to do a little bit of data analysis on the data that we have, which, again, remarkably, per Professor Ioannidis from Stanford, we are still in an environment where you have some people, including some people who occupy governor's mansions, relying on mathematical models or epidemiological models over the real world data. It's flabbergasting to him and many others, including me. Going back to Rogers, did a one variable correlation of deaths per million and days to shutdown to assess lockdown versus no lockdown. Does it matter? Ranged from minus 10 days. Some states shut down before any sign of COVID-19, to 35 days for South Dakota, one of 7 states with basically no shutdown. The correlation coefficient he found, 5.5%, so low that the engineers that I used to employ would have summarized it as no correlation and moved on to find the real cause of the problem. Real causes like other variables they looked at, population density or subway use. Our correlation coefficient for per capita death rates versus population density, 44%. That suggests New York City might have benefited from its shutdown, but blindly copying New York's policies in places with low COVID-19 death rates, and say, for example, subway systems, nothing akin to what New York City relies on. Using those policies in places such as my native Wisconsin doesn't make sense. Different policies for different locales. Right. Regional approach. Sweden, he goes on, looked at Sweden, and how are they doing? We've talked about Sweden a lot, and this continues to be an outlier, so it's going to be compared against other Western nations, European nations, as well as America. 80 million deaths per 21 after crossing the 1 per million threshold with 10 million people. Sweden's death rate, without a shutdown and without massive unemployment, because there was no shutdown, is lower than the 7 hardest hit U.S. states, Massachusetts, Rhode Island, Louisiana, Connecticut, Michigan, New Jersey, and New York, all of which, except Louisiana, shut down in 3 days or less. Sweden, again, in the middle of the pack in Europe, and we've talked about that a little bit yesterday in conjunction with the fabulous Bakersfield boys about Sweden versus Norway. Not statistically significant death rates. For more on modeling and why so many were so wildly wrong and implicated perhaps some wildly erroneous public policy making, we're pleased to be joined by Phil Magness. Phil is the Senior Research Fellow at the American Institute for Economic Research, author of the 1619 Project, a critique and cracks in the ivory tower, the moral mess of higher education. Phil, thanks for joining us. Appreciate it.
Hi, Dan. Thanks for having me.
So, we continue to see people from various disciplines just using real-world data. Will Riley over at Kentucky State did a regression analysis, finally basically came up with the same conclusion that TJ Rogers and his engineers at the semiconductor company came up with. And you've looked at a new research paper out by Harvard and MIT health economists that suggests why, for example, the much relied upon Imperial College London model was so wrong.
Right. So the problems that are coming out with the Imperial College model is they made some very unfounded assumptions when they launched this projection back in March, and it's the one that we all heard in the news, saying that 2.2 million people would die if we did not go into lockdown. It's the one that was cited by President Trump. And then in the UK, you had a similar projection of 500,000 deaths that swayed the Boris Johnson government to abandon a herd immunity strategy in favor of the lockdowns that they now have in place.
Yeah, and why? And this was wrong, not just because it was not predicated on real world data, because this was before the outbreak really became pronounced enough to have significant data, but it just predicated on a fundamental misunderstanding of human behavior.
Yeah, I'd say so. So the 2.2 million death toll projections were all based on what they called their do-nothing scenario. That was basically as if the world stayed the course and almost pretended as if the pandemic didn't exist and just kept on the same behavioral track. But they actually concede in the paper that the do-nothing scenario itself was unlikely, even though they're hyping it to the press at that time. They're telling the New York Times that this is a realistic scenario when it wasn't at all. But what we know from other sources of data is up to about a month before the lockdowns went into effect, so we're talking about mid to late February, people were already modifying their behavior in response to the threat of the pandemic. And you can think about this if you're going down the grocery store aisles. What was sold out at the time? It's Lysol, it's hand sanitizer, it's basic hygiene materials that people were using to wash their hands with higher frequency. We saw some other data. I think OpenTable, the restaurant reservation app, released its data for February and March, and there's a precipitous decline in all 50 states of restaurant reservations starting about 2 weeks before the lockdowns set in place. So what this tells me is that people are modifying their behavior in the face of this risk, in the face of this uncertainty of a very deadly disease before the lockdowns are even in place, and none of that's accounted for or built into any of these models that were projecting these horrendous death tolls.
So who is the more responsible party, I guess? Is it Neil Ferguson and Imperial College London for hyping the top line and not all the caveats, or is it the media for just reporting the top line, even though all the caveats were included there for contextual information and thus contextual reporting? The politicians who ran with all of this, even though they had the contextual information too, and I guess just ignored it or were willfully blind to it. I mean, somebody has to sort of be the most fraudulent party here.
Right. I think it's actually an unfortunate combination, like a perfect storm of all three of those things. So Ferguson himself, if you read the paper, it's much more subdued in its projections than his public commentaries to the New York Times and to the rest of the UK press at the time. So we have an example of March 20th. This is about a week after lockdowns begin in earnest. He's still touting the 2.2 million figure to the New York Times in a major column that highlights it in its headline. A month later, we still have the media and we still have President Trump that are citing this 2.2 million figure as the scenario that would have played out had they not engaged in a heavy-handed lockdown policy. So I think what we have is a media world and a political world that really rewards and gives a lot of attention, undue attention, to extreme alarmist models, whereas the more tempered, necessary data analysis that we have, the stuff that Professor Ioannidis at Stanford has been calling for, falls by the wayside. It tends to be suppressed because it doesn't grab headlines.
That's a pretty good summation. Phil Magness, Senior Research Fellow at the American Institute for Economic Research, author of the 1619 Project, A Critique and Cracks in the Ivory Tower, The Moral Mess of Higher Education. Phil, thanks for joining us. Appreciate it.
Yeah, thanks for having me.
Take care.